reserves. For what purpose does the gentleman from Tennessee seek recognition?
Thank you, Mr. Speaker. I rise in opposition to the amendment.
Without objection, the gentleman is recognized.
Thank you, Mr. Speaker. And I thank the Speaker. There is no question that prescription drug prices in this country are too high and that too many Americans cannot afford the life-saving medications that they need. And I wish the bill we were debating today would solve that problem. Sadly, it does not. The premise of this amendment is that the VA should be able to lower drug costs if the savings predicted materialize. But make no mistake about it, a bill that stops cures from coming to market and discourages innovation is bad for veterans, bad for America, regardless of the effects of this amendment. Further, with this amendment, we should be putting the brave men and women who've served our armed forces and are seeking care from the Veterans Department of VA at risk. Congressman Cunningham's amendment would expand the scope of this bill to include the prescription drugs provided by VA. As well-intentioned as Congressman Cunningham's amendment might be, this is the wrong thing for veterans. Mr. Speaker, let me just reminisce a little bit. When I graduated from medical school, there was a disease out there we did not know the name of. We didn't even know the name of it. We later discovered it was hepatitis C. We've gone from not even knowing the name of this disease to being able to cure it in 8 to 12 weeks. Let me tell you what this incredible innovation has done for our nation's veterans. The VA has cured more than 100,000 veterans of hepatitis C since 2014. Remarkable. Cutting the death rate by 50%. That's innovation that's done that. Because of this treatment, veterans cured are estimated to have a 72% less likely chance of developing cancer of the liver. Fewer than 25,000 veterans out there are now untested that are at risk, and the VA is to be applauded for this. Let me digress to my first pediatric rotation in medical school in Memphis many years ago. My first inpatient rotation was St. Jude's Children's Hospital. At that time when I saw those children, 80% of them, Mr. Speaker, died of their disease. Because of innovation and research and doctors and nurses and others that went in every day and saw these children die, today, 80% of those children live. And if we don't stifle innovation, 100%, my prayer is that 100% of these children live. This H.R. 3, my concern is not what it will do, it's what will be left undone when we don't have these cures. And I know that's not the intent of my friend. We serve on the committee together, and I know that's not the intent. My concern is that is exactly what will happen. This system, and right now I want to submit to the record, this is a list of drugs right now that the VA does not have on its formulary because it's closed. And Mr. Speaker, further with this amendment, I would encourage, we have a system now that works, and I would encourage my colleagues to not support this amendment, and I reserve the balance of my time.
The gentleman reserves, and that request will be handled under general leave. The gentleman from South Carolina is recognized.
Mr. Chair.